So now I'm going to touch on the amyloids, and those are indigestible protein structures that don't break down through the cooking process. And that was one of my big discoveries almost a decade ago when I helped somebody, again, with end-stage cancer, not die because he had amyloidosis, amyloids measured by light chains. He was given his last rites, told to go home. This was one of my forays into this phenomena of amyloids. And Glenn is alive 10 years later, and he's doing great. And so amyloids were a very, very big contributor to his situation, along with other things, but amyloids were the big ones. And I'm like, oh my gosh, when I discovered the whole concept of amyloids, that they were coming from our food supply, and the dirty bird being the most amyloid-rich bird because of the crowding conditions, which have contributed to these indigestible proteins being formed in the tissues of these animals, chicken being the worst, and then commercially farmed meat, and then pork and turkey. That's why wild came into existence. I did the study to inform myself that if we take on lower burdened amyloids, we're not making these truncated protein structures, which not only do bad things and create things in our body, they also help to turn on viral loads. And so that's why autoimmunity, even 8 years ago, was already 1 in 14. Now autoimmunity, as you've noted as well, Sara, is, I don't even know the statistics.
Yeah.
It's up like this. It's not just like this. It's like, and so we are ever more busy. We have a 911 call to our clinic almost daily because another new thing is going on and the doctors are confused, or the doctors just don't have the level of information to be able to make decisions based on this new phenomenon, this layering, as I call it.
So just to clarify, everyone, these amyloids are in chicken, in turkey, in pork, conventionally raised beef, other poultry, but you are good to go with duck or pheasant or wild poultry. Would that be correct?
Yes, wild turkey, Cornish game hen, we haven't had problems with. Quail. Pheasant is great. I love pheasant. Like I eat it. I haven't had a piece of chicken in almost 8 years now. It'll be 8 years in August. And I don't miss it. And it can actually, so I will say, if chicken is contributing to turning on a virus that has to do with the way that your pancreatic cells work, and especially in the beta cells, it could actually be contributing to your becoming insulin resistant, which is contributing to your weight gain. So chicken can make you fat, effectively, kind of like bottom line.
Right. And I've done 2 studies on, or 2 podcasts on Alzheimer's lately because it is blowing up in the news, right? And they're talking about the beta amyloid. So can you talk about the connection? Is that the same amyloid?
Yes, they're all connected. Amyloids are amyloids or amyloids. There's alpha amyloids, beta amyloids, but they're effectively amyloids. And so Alzheimer's is now the fifth leading cause of death in the United States. That was before the pandemic. That's a statistic. I believe it was 2019. And so Alzheimer's has also been called type 3 diabetes, back to insulin, back to histamine, back to protein. Okay. So we really have to look at the intersection of these disruptors that layer one another and be mindful. Am I saying never have a piece of broccoli, which is the sulfur, or never have some spinach, which is an oxalate, or never have berries, which are an oxalate, or never have a chocolate, which is histamine, or a banana or an avocado, which are considered histamine? Never saying never. It's just something sometimes, and understand your genetic blueprint and your current state of health and your supplementation plan and your IVs and your pharmaceuticals. Anything, my new phrase is, we look at everything that goes in you, on you, or around you.
Right. Okay. And I have to speak to my own experience with you, is that I've been in a great state of health where I've been able to eat all of the things that you've talked about. Maybe not chicken, but I still was able to eat the oxalates, the sulfur, what have you. And then last time I saw you, when my varicella virus was active, you said absolutely no amyloids whatsoever, and stay off the sulfur and oxalates. And I was doing better with my fat, but it shows that it's truly complicated, and we are such a miracle beings, and we're not simple, right?